Good afternoon, folks, and thank you very much for coming along today to give us the opportunity to talk about some of the research that we're carrying out at the University of Ulster. Today I want to talk about the very important role that is played by parents in raising children on the autistic spectrum, and I'd also like to look at the impact that giving parents proper training in positive impacts that they can make on their child, the positive impact that can have on a child's development. And also I want to highlight the specific stresses and strains that parents of children with ASD also have to face as well. I'd just like to start by saying that before taking up my post at the University of Ulster, I actually worked in the community for 8 years with families in a local charity, and my job was to go into family homes and to basically set up home programs or set up school-based programs for kids with ASD. Now, part of that was going into a family home where, for example, we may have a family who have a stay-at-home parent full-time, and the intervention that we can put in place has to very much work its way around that family setup as well. So to expect them to go into a family with a single parent who works full-time with another 2 siblings and expect them to do exactly the same thing is a very short-sighted way of doing things. So what we wanted to always do was to set up a program that parents could carry out to the best of their ability. And in order to do that, the thing that we had to do was you had to train the parents in effective strategies. And that really was the basis of that we worked on for Pete for the number of years that I actually worked there. So I'm going to just go through, as I say, some of the data, looking at the stresses and strains that parents with kids with ASD have to face, but also then I want to look at the impact that giving parents proactive things that they can do, and how that actually has a positive impact, not only for the child, but also for the mental health and the well-being of the entire family. So a recent report came out on the BBC there a while ago, basically saying that a report from the Department of Health noted that the number of children being diagnosed with ASD had risen by 67% since 2009-10. Okay, so that's a pretty significant increase by anybody's measurements. And also, somewhat worrying was that there were 1,300 families awaiting a diagnosis for their child. So that's 1,300 families who are, if you like, at this point in time, left in limbo. The clock is ticking for those particular families. We heard about the importance of early intervention from previous speakers. And what we need to do is we need to basically have interventions put in place straight away to help those families to have the greatest level of impact. So really, really important that we have families who maybe have to wait up to a year for that diagnosis to be carried out. The clock is ticking for those families. And if we want those children to catch up, then they need to actually learn at an accelerated level. And the longer that we wait, the harder that is to do. So if early intervention is the way to go, we can't find ourselves in a situation where parents are left in limbo and not able to do anything with their children until that diagnosis arrives. And that's why it's important that we give parents proper training. So what I want to do, as I say today, is I want to look at the fact that we have increasing numbers, we have longer waiting times for parents to get a diagnosis, and we have to think about the fact that parents are, if you like, an untapped resource. They have the greatest reason to help their child because it's their child. Anybody here who's a parent, you know you would do anything for your child. So parents are an untapped resource, and we want to make the most of that untapped resource and give them proper levels of training. But the interesting thing is that despite the fact that it's parents who carry the greatest burden of caring for their children, there's been little investment in effective parent training. We carried a bit of research funded by the Royal Irish Academy in 2007. And basically, the families who responded to the study, both north and south of the border, reported that, for example, they were restricted in pursuing personal, educational, occupational and employment interests. So what was happening was parents, in a lot of ways, were almost kind of putting their lives on hold while they were working with their child with ASD. Things that they would have, for example, that you would take for granted, like taking your kids out to the cinema, taking the family to a restaurant. Families sometimes balked at the thought of doing that because they were concerned about going into a restaurant and maybe sort of behavioural issues, etc., coming about. We also have the situation where, for example, parents are leaving full-time education in order to look after their children. Parents, especially mothers, who are leaving full-time employment to look after their children as well. So those huge impacts that not only does the ASD affect the individual, but it has a huge impact across the entire family. Another one of the pieces of information that came out from the report was that parents of children with ASD experience considerably more psychological distress than the general population. And the study found that 88% of parents reported that their stress levels were high or quite high. Okay, so that's a huge amount of stress within a family. As well as having the kind of mental health issues, the parents also reported they had greater levels of chronic long-term health conditions, so physical health conditions as well. So there's a huge amount of strain on families at the best of time. When we look at the social support mechanisms that are in place for the families, it was also noted that the families reported that they did not receive sufficient support or advice and information during and after the diagnosis, and also during the educational statementing process. So, as well as having the, if you like, the news that they have a diagnosis of a child on the autistic spectrum, that stress just carries through. For example, how are we going to get the child into an educational placement that's going to be suitable? Are we going to be ensure that the child gets all the support that they possibly need? And that's a huge amount of strain that goes on, from the day and hour that the families get a diagnosis. So that's really important that we try and help families address this. There was also significant distress which came about when families were looking for respite. So things we take for granted. You call the babysitter, you go out for dinner with your partner. Not everybody with a child with ASD is going to be comfortable in who they feel they can leave their child with. Will the person be able to cope? How will the child react to the change? All those things are huge stresses, things that we take for granted that a family with a child with ASD may not be able to access at all. So you can just sort of see the levels of stress building up here. And then what actually happens is that oftentimes families have difficulties accessing these supports from statutory services. So what often happens is that they end up going to non-statutory services such as local charities, or they may rely on family support as well. Luckily, if you have a large extended family, that may be possible, but not everybody's in that sort of position. And a lot of people do tend to feel somewhat socially isolated once they have a child with a diagnosis of ASD. We also had parents who were prepared to move house in order to gain appropriate services for their children. Now that could be within the auspices of Northern Ireland. It could be moving from one education library board area to another education library board area. It could also have been people from Northern Ireland moving to the Republic of Ireland. And in some extreme cases, we also had families who left Ireland to go and live in the United States. Okay, so that's a huge commitment for a family to make, all in order to get the best outcomes for their child. When we look at the actual stresses that we've just discussed, it's quite clear that parents have very high levels of stress, but one of the pieces of research I want to look at are how parents actually cope with those high levels of stress. So there's a study carried out by Hastings et al. In 2005, and they identified 4 strategies used by parents. The first strategy used by parents that was reported to them in the study was what they call active avoidance. Now that could be something, for example, like a parent staying and work for longer hours instead of feeling the need to come home. It could also be, for example, as we said before, not taking your children to that particular birthday party, not taking your child to that restaurant, not taking your child to that swimming pool because you're concerned about what's going to happen from a behavioural point of view. It could also be in a much more serious situation where the active avoidance actually involves substance abuse, should that be drugs or should that be alcohol. So active avoidance being one type of coping mechanism. The second type of coping mechanism was a problem-focused coping strategy, and that's where parents basically engaged in planning for the future, in active coping strategies and seeking community support. The third type of coping strategy was positive coping, and that would have been, for example, where parents would have dealt with things very much in a humorous way. And in the years that I worked out in the community, I met some parents who had a wonderful attitude and basically sort of went at everything in a very positive way. But positive coping could also be something like, for example, if they had a child who, for example, had a higher than normal level IQ, they would really focus on that as opposed to maybe being concerned about, for example, a child who had great social difficulties. So that's sort of a positive coping strategy as well. And then lastly, there was the religious and denial coping, which is where basically people were looking to deal with their issues through prayer or through some sort of intervention that way, or just being in denial altogether. And the research basically demonstrated that those parents who had problem-focused coping skills had actually better outcomes in mental health. So problem-focused coping skills had the best outcomes for mental health. A similar piece of research by Dunn et al. In 2001 noted that parents of children with autism experience more stress and are more susceptible to negative outcomes than parents of children with other disabilities. So compared to, for example, the population of parents with children with Down syndrome or population of parents with physical disabilities, parents of children with ASD actually had greater levels of mental health issues. The researchers examined the relationship between the various stressors that parents had, and as I say, stressors could be huge and wide. So, for example, a child who doesn't sleep at night, a child who has very restricted diet, should that be the amount of food that they eat or the range of foods that they eat, worrying about your child's education, worrying about, one of the big worries that always came out in the research we looked at was, what happens when I die? What happens if anything happens to me? What will happen to my child? So a huge amount of stressors that are being faced by parents. And the study looked at the level of social support that parents reported having. A locus of control, that basically means if a parent felt in control of the situation, how they dealt with the situation, or if the parent felt that the situation was out of their control, how they cope with that situation as well. And they also looked at negative outcomes then, such as depression, feelings of social isolation, and spousal relationship problems, so breakdown in marriages and stresses and strains from that perspective as well. The results of the study showed that higher levels of depression were correlated with low feelings of control and avoidance as a coping strategy. Low feelings of control and escape as a coping strategy were also correlated with increased feelings of social isolation. And low levels of social support were further correlated to increased levels of spousal relationship problems. So once again, when parents didn't have positive, proactive coping strategies, there was an impact on mental health. Further research has demonstrated that those parents who are actively involved in any intervention involving their child, actually, the data demonstrate that those parents who are actively involved have much lower levels of stress, and that goes across the whole family. So parental involvement in interventions is mirrored by reductions in family stress. And there are also better outcomes for the child from the point of view that the research has demonstrated that the children have better outcomes for non-verbal and verbal communication. Not every child is going to learn to use verbal language to communicate. Other children, for example, may use Makaton, sign language. Other children may use picture exchange communication systems. But at the end of the day, as long as a child has some sort of functional communication and can put across their wants and can put across their needs, that's a very positive outcome for the child, but it's also a huge outcome for the family. You know, I saw, for example, kids who would be standing in front of a cupboard and getting very upset as mum's bringing down, is it Cocoa Pops you want? Is it Frosties you want? Is it biscuits you want? Is it a slice of toast you want? And the child is upset until mum pulls out the correct thing and the behaviour calms down. That's an unbelievably stressful situation for a family. Unbelievably stressful for the parents, unbelievably stressful for the child. So if they have a good functional communication system put in place, that will automatically have a huge impact on decreasing those stressors. Behaviour management is also a huge one. I think every parent's nightmare is that temper tantrum in the middle of Tesco's on a Friday night. Okay, everybody looking at you, we've all been there. But at the end of the day, if parents are given the tools to help them deal with those situations, that brings down stress as well. It also allows parents to feel confident in going out to those various places without feeling that they're going to be under added pressure. Higher levels of appropriate play skills have also been reported. So I think if we look, for example, at a typically developing child, they sit with their little action figures and they act out all the little scenarios, whereas a child on the autistic spectrum may move the action figures about in their peripheral vision, or instead of moving a car about on the floor, making the engine noises, they'll turn the car over and spin the wheels. They'll play with toys in inappropriate ways. Well, once a program's been put in place that the parents are involved in and the child develops appropriate play skills, that has a huge impact on mental health for the parents as well. Imitation and social responsiveness. So kids who are able to learn by watching other people and copying what they do. A lot of kids on the autistic spectrum have difficulty doing that, and it's a really quick way to learn. And if kids learn generalized imitation skills, then you can see their improvements just taking off. And also greater levels of positive parent-child engagement. Parents who are able just to turn around and say, you know, I enjoy being with my child. This is my son, this is my daughter, this is my friend. You know, this is a person that I enjoy being with. That's a huge impact. And especially if we look, for example, in situations where oftentimes when I was working in the community, fathers in particular sometimes felt they were very much on the periphery of the entire situation, where mum was sort of the go-to person, and dad felt he was kind of outside. So allowing dads especially to build that positive relationship with their child has a huge positive impact on family systems as well. Now, in 2005, when I was working for Pete, national lottery funding was obtained to develop a multimedia training pack for parents, and it was called Simple Steps. And Simple Steps was made available to families in Northern Ireland. And we had very positive feedback about Simple Steps when we went off to international conferences and showed it off. Because of that, European money through the Leonardo da Vinci Fund was sought in order to translate Simple Steps into 3 different languages. Initially it was Spanish, Norwegian and German. And that project came into being in 2008. And then in 2010, we applied for further funding to translate the package into Swedish, Italian, Dutch, Icelandic, and I can't remember, maybe another one in there. But basically, this is a list of the universities who were involved in the STAMP project. So there was ourselves at Ulster University, and Queen's University, Erasmus University in Rotterdam. I'm not going to embarrass myself by trying to speak Italian, so I'm going to just tell you that that is the European Institute for the Study of Human Behaviour in Milan. We also have, I'm not going to speak Swedish either, that's the Institute for Special Education in Stockholm. We have the State Diagnostic and Counselling Centre in Iceland, which is basically the diagnostic centre that diagnoses every child with ASD in Iceland. We also had a colleague of ours who was the European Association for Behaviour Analysis as representative for Applied Sciences, called Neil Martin. He had his own organisation called ANTAM. Obviously, because Pete had developed the original Simple Steps, it was involved as well. And then we also had the University of Oviedo in Spain, Akershus University just outside Oslo in Norway, and also the University of Applied Sciences in Munster. So as you can see, we have a very wide range of countries there. And the whole project, in fact, Simple Steps came about, and the whole project came about because we need to provide parents and professionals with an informed choice for their children. What can we do for our kids? Let's inform parents about what it is they're actually able to do for their kids, and to give the parents the training and the basic science that they can make data-driven decisions to ensure they're doing the best for their kids. If your child's having 7 temper tantrums a day, and you put an intervention into place, and your child's still having 7 temper tantrums a day, that's not working. If your child's having 7 tantrums a day, you put an intervention into place, and that drops down to 1 or 0, that is working. Okay, so teaching parents about basic science in order to help their kids. And as I say, the whole project was funded by the Leonardo da Vinci Lifelong Learning Programme. And Simple Steps used video footage of parents and their children to educate other parents and professionals on all aspects of autism. So we had parents and professionals talking about the diagnosis process, but also parents talking about their experiences of being a parent with a child with ASD. And it doesn't matter what doctor this says or professor that says, I don't care. A parent telling another parent is a much more powerful message. And we had a lovely situation where we had parents saying, I was in exactly the same boat as you, and look where I am now. And that's a very powerful message for parents to hear. We also had a section on understanding behaviour, and this is vital. Teaching parents to understand why their kids are doing the things that they're doing puts them in a much better position. So if you have a child stomping their feet and throwing toys, if that child's doing that because you're on the phone with your best friend, the child's doing it for social attention, we'll deal with that in a very specific way. However, if your child is stomping their feet and throwing toys because you've said to them, turn off Thomas the Tank Engine, you're going for a bath, that's escape avoidance. We deal with that in an entirely different way. If your child is trying to communicate to you and you can't understand what they're saying and the temper tantrum appears, once again, we deal with that in a very different way. Kids with ASD, I've had kids with ASD who have discovered this wonderful instrument here. and they will shout, and they will roar, and they will make a lot of noise, because it's just great. It's self-stimulatory behaviour. We deal with that in an entirely different way. Suddenly parents who are being told, this is an understanding of why your child's doing what they're doing. The parents become empowered. They feel confident about putting interventions into place. And that's a very powerful message. Measuring behaviour. Very important. If I turn around and I say to you, child A has 10 temper tantrums a day and child B has 10 temper tantrums a day, that's only one way of measuring behaviour. But if I turn around and I said, well, this child's temper tantrums are between 7:30 and 9 o'clock, and this child's temper tantrums are throughout the day, well, there's clearly something wrong with this child's morning routine, and we would have to deal with that particular issue. Whereas with this particular child, something very different is going on. But getting parents to make those simple measurements about their child behaviour, once again, empowers them to make the proper intervention. Increasing behaviour and teaching new skills. One of the first things I always say to parents when I'm working with them is, you're going to come along to me with a whole load of problems, of things that you're worried about. The first thing I want you to do is I want you to take a piece of paper and sit down with mum and dad and granny and write down all the good things your child does. Because believe you me, I have never worked with a child who has more inappropriate behaviour than appropriate behaviour. And parents need to see or remind themselves that their kids do an awful lot of good things. They know how to work with their kids. Nobody's ever going to know their kid better than them. So it's really important that parents can understand that. And then we can build on those good behaviours and make sure those good behaviours are maintained. Because when it comes to dealing with inappropriate behaviours, if you think about a piece of behaviour, it takes up time and space. If you remove that piece of behaviour from somebody's repertoire, a vacuum's created. Another piece of behaviour is going to fill that vacuum. And we want to make sure it's an appropriate piece of behaviour that fills that vacuum. So it's vitally important that parents can realise the good things that their child does and build upon those. The overview of STAMP was we wanted it to be parent-friendly and scientifically accurate. The point I wanted was that if a professional behaviour analyst read Simple Steps or watched Simple Steps, they would say that's 100% scientifically accurate. But a parent could also turn around and say to me, I watched that and I understood that. That was the balance that we wanted to get. The other thing is it initially started off as a hard pack with a DVD and a CD-ROM and books and stuff like that included in it. We wanted to move everything online so it was available 24/7 to parents who required it. It also had to be culturally sensitive. So, for example, the diagnosis process was very different in each country. Silly things like, for example, the Spanish version preferred voiceover, whereas the Norwegian version preferred to be subtitled. We had some lovely video footage of me working with a wee guy, and every time he did something right, I went, well done. That's apparently very rude in some Spanish-speaking parts of the world, so we had to take that out. Okay, so the whole thing had to be culturally sensitive. And then we put in an awful lot of practical stuff on measuring behaviour through interactive teaching to give parents the opportunity to practice working on video footage, recording behaviours there before they turned around and actually started doing this with their own child. Teaching parents to learn to teach their own child. That's more or less what we were doing. Empowering parents to make a difference with their child. That's what the website actually looks like. Apologies, that's a little bit on the small side, but you can see there we have Germany, Iceland, Italy, the Netherlands, Norway. Actually, outside the project, some Portuguese families funded the translation themselves. So Portuguese is there as well, Spanish, Swedish, and then obviously the English versions as well. And it's also available in India as well. So I think it's interesting that we have a project here that was born in Northern Ireland and is available throughout Europe and other parts of the world. You know, people talk about NIPLC. Well, that's a lovely example of the universities working together in order to do something that has a very positive impact for Northern Ireland. So, in each of the countries, we collected some feedback on what the parents actually thought of Simple Steps or the STAMP project. And what we discovered was that the feedback from the project showed that parents strongly agreed that the tool helped them to, number one, understand their child's behaviour. And that in itself reduced stress levels like you wouldn't believe. Understanding why is wee Johnny doing that? Number two, it helped parents to decrease inappropriate behaviour. A huge issue for a lot of parents. Number 3, it helped parents to teach their children new skills. So teaching parents to decrease those behaviours that impede their child from functioning as successfully as possible in their environment is hugely important, but also then teaching the kids the skills that they need to function in their environment. So that's just two sides of the same coin. The important thing from our point of view, though, was regardless of which language the product was actually was translated into, we had a product that was easy to understand and easy to use. And the very important thing was the parents reported that it made a significant difference to their child and to the family. Okay, so not only to the child, but also to the family unit as well. And the other thing that the parents found very useful was that the resource was available continuously and was therefore easily accessible 24 hours a day when required. So basically, just to kind of come to the end now, this presentation recommends the government in Northern Ireland invest in parent training as a cornerstone of evidence-based practice while drawing on a European project that originated in Northern Ireland to meet the needs of parent training through the use of internet-based training and evidence-based practice. And I think if we look at our previous speakers today, the need for us to be proactive as a community and helping those with learning and intellectual disabilities is vital, but also the importance of early intervention and the fact that the cost-benefit analysis of early intervention means that the wonderful untapped resource that we have in parents needs to be built upon. Okay, thank you.